The elbow is subjected to significant forces when you're throwing a baseball. And there is a ligament on the inside of the elbow that we refer to as the ulnar collateral ligament. And in the course of throwing a baseball, there are severe stresses placed upon that ligament. And unfortunately, due to various factors, that ligament can become injured. Oftentimes, that necessitates surgical intervention. Now, unfortunately, we've seen a precipitous rise in the number of ulnar collateral ligament surgeries or Tommy John surgeries done over the last decade. There are several factors for that. Number one is simply as physicians, we're recognizing the injury more. We have various tests that we do in the office. Our examination skills are improved. We also have better MRI techniques to look at the elbow and to determine whether or not there's an injury to the ligament. We also know that patients are more informed. As I mentioned earlier, it's not uncommon for a 10-year-old to know what Tommy John surgery is. And so in the past, if someone had medial elbow pain or pain on the inside of their elbow and they couldn't throw a baseball properly, they would simply call it quits and not play baseball anymore. Now they're going to physicians looking for an answer and cure for this problem. Now, the other reason that we're seeing an increase in the number of these surgeries is simply overuse. And this is an unfortunate consequence of what's occurred with youth sports over the last decade or so. We're seeing that the number of young people involved in sports is increasing. We've seen that their participation in organized sports has been increasing. You know, it's one thing to be playing catch with dad or mom in the backyard. It's another thing to be involved in an organized sports league that places certain pressures on our young athletes. And we're seeing a significant rise in the number of injuries to this ulnar collateral ligament. And certainly we know that overuse or throwing too much plays a role in that. So obviously our main goal would be to prevent these injuries. And again, the way that you prevent these injuries is by monitoring pitch counts for our pitchers. This is certainly an injury that occurs more often in pitchers. We see it in athletes who play all positions, catcher, infield position, outfield positions. We see it primarily in baseball, but we have seen a number of these athletes who play softball. We also see it in tennis players. To a certain extent, we see it in football players also. Tennis players and other overhead athletes of that nature. We'd like to try to prevent these injuries. I mentioned pitch counts is one of them for pitchers. We also recommend taking at least 3 months off from throwing a baseball if that's the sport you're involved in. We're seeing year-round baseball now, and that's something that wasn't available just 5 or 10 years ago. And we certainly theorize that playing year-round baseball is harmful because you're not allowing the tissues to heal. There's a process that occurs with injury versus healing in the body, and it's very, very important to allow a healing process to occur. And so that's why we recommend at least 3 months off from playing baseball if you are a year-round baseball player. If this injury should occur, we fortunately have alternatives with regards to getting someone back on the field. Several decades ago in the 70s and 80s, if you had this injury, your career was over. Now there is a surgical procedure that we can do. Most of you know it as the Tommy John surgery. And basically what we do is we rebuild that ligament on the inside of the elbow. We use various tendons from within the body, usually a tendon in the forearm or a tendon in the leg, and we rebuild that ligament on the inside of the elbow. It's a surgical procedure that we found success with. About 90% of people can get back to playing competitive overhead sports following this surgical procedure. So it is a procedure that has worked well. Obviously, we would like to avoid having to do that procedure if we could.